About 5.5 years ago, I noticed that my bowels were not behaving as they had always done in the past. Things weren't quite right, so I spoke to my doctor about it, and he immediately told me that I needed to have a colonoscopy to find out what was going on. The surgeon who was conducting it said, "You've got a serious problem. You and I need to have another meeting tomorrow in the operating theatre where I will remove what I believe to be a bowel cancer." I was then asked to see an oncologist who told me that because of what they found, he believed that I should have a course of chemotherapy. He told me that the standard course of chemotherapy was 12 doses of the chemical over a period of 24 weeks. And he then started to talk about clinical trials, and he said that this SALT trial was in operation, and that they were trying to find out whether or not perhaps half that amount of treatment would be just as effective. He gave me a heap of reading material as to the pros and cons of it and asked me to go away and think about it, which I did, and discussed it with my wife, and we agreed that it seemed like a good idea at the time. The information talked about ethics committees at universities and people who would have examined what was proposed in great detail before it was approved as a trial. And so I had every confidence that anything that was being done differently still had the backing of the scientific reasons for doing things. I believe that we're here to look after our fellow man, if you like. And the oncologist and the trials staff explained to me that it would potentially benefit others down the track, and it seemed to me that was the right thing to do. The way that I had to approach it was simply to turn up for the chemical to be infused, irrespective of whether I did it for 12 infusions or only 6. The only difference from being in the clinical trial or not was that I would have an extra level of people to talk to, if you like. I would have my GP, obviously, I would have the oncologist, but on top of that I would also have the clinical trial staff. And that's one thing that I found to be of use. I was better able to ask them questions about what was going on, what this meant, what that meant. Because of that, they were able to deliver that comfort. And I think that was vitally important. One of the clinical trial nurses had been a cancer survivor as well, so she had some perhaps even better rapport, if you like. Medicine is advancing all the time, but it can only advance with help from the patients. It's all very well the scientists and the doctors coming up with new treatments, but until they try those treatments, then they're not going to know with any certainty whether those treatments will be successful. And I think there's two ways of looking at that. One is to say, well, I'm doing the right thing. But the other side of the coin is that there is the potential that there will be some sort of benefit. All my results have been positive, and I have no recurrence of the cancer. I've had no issues with anything more. Because I was in the clinical trial, I had probably more tests than I might otherwise have had. The CT scans went on a bit longer, another couple of years, and I guess that was another comfort, if you like. If anything, it's made me more inclined to get on and do the things I want to do that I'd been putting off. Being able to disappear for a long weekend or a week or so with the caravan if I feel like it. Being able to do the things I want to do, like sit and read a book for the afternoon if that's what the mood takes me.